Hello, future public health heroes, and welcome back to the channel. Today, we're diving deep into a fundamental concept that every public health professional needs to master: prevalence. Ever wondered how we know just how big a health issue is in a community? That's where prevalence comes in. So grab your notebooks and let's get started. Imagine you're a public health nurse, and your city wants to understand the impact of diabetes. You're asked, what does the prevalence of diabetes tell us? You're given a few options. Does it show the risks of getting diabetes? Does it just confirm that diabetes is present? Does it automatically show us our top priority? Or does it indicate the magnitude of the health problem? If you picked magnitude of the health problem, you are absolutely correct. Let's break down why this is the right answer and why the others fall short. Prevalence is like taking a snapshot of a community at a specific moment. It counts everyone who currently has a particular condition, both brand new cases and people who have been living with it for years. By adding up all these existing cases, prevalence gives us a clear picture of the total burden of that disease on the community. It tells us exactly how widespread the issue is. Think of it this way. If a city has a high prevalence of asthma, it means a large number of people are currently dealing with it. This number, this magnitude, is crucial for planning. Why is understanding this magnitude so important? Because public health is all about smart resource allocation. When we know the prevalence of a disease, like diabetes or hypertension, we can estimate how many clinics, nurses, medications, and educational programs are needed to care for everyone affected. A high prevalence signals a high demand for services. It helps officials justify budgets, hire staff, and ensure the healthcare system is prepared to handle the load. It's the data that drives real-world decisions to manage chronic diseases and support community well-being. Now let's look at why the other options aren't the best fit. What about risks to health problems? While related, risk is actually better measured by something else called incidence. Incidence tracks only the new cases that appear over a period of time. It's like measuring the flow of water into a bathtub. A high incidence tells us that many people are developing the disease, which helps us investigate risk factors and focus on prevention. Prevalence, on the other hand, is the total water in the tub at that moment, the existing burden. It doesn't tell us the probability of a new person falling ill. What about presence of health problems? Well, yes. Prevalence does confirm that a health problem exists. If the prevalence is greater than 0, the disease is present. But that's a very basic interpretation. The real power of prevalence isn't just saying it's here. It's telling us, here's how much of it is here. The term magnitude captures that scale and scope much more accurately. It's the difference between knowing there's a puddle and knowing you're facing a lake. Finally, does prevalence alone determine the priority needs of the people? Not quite. Setting priorities is a much more complex process. Imagine two diseases. One has a very high prevalence, but is mild and easy to manage. The other has a low prevalence, but is severe, deadly, and expensive to treat. Which one is the bigger priority? To decide, we need to consider not just prevalence, but also the severity of the illness, its impact on quality of life, the cost of treatment, and what the community itself values. Prevalence is a critical piece of the puzzle, but it's not the whole picture when it comes to setting priorities. So, let's lock this in. Here's a simple mnemonic to help you remember the difference between prevalence and incidence. Think of P for prevalence as the pool, all the existing cases currently in the water. Think of I for incidence as the inflow, the new cases trickling into the pool. Prevalence quantifies the current burden, guiding resource allocation. Incidence quantifies new risk, guiding prevention strategies. Both are essential, but they tell us different things. And that's a wrap on our deep dive into prevalence. Understanding this concept is key to making informed decisions that improve the health of entire populations. I hope this breakdown was helpful. If you found value in this video, please give it a thumbs up, and do not forget to subscribe and hit that notification bell so you wouldn't miss our next public health lesson. Thanks for watching, and see you in the next video.